All right, I'm just going to give it one more minute. We have just a few people joining us. For those just joining, please make sure that you are muted and you can post your questions in the chat. Feel free to tell us who you are and where you're calling from. Well, we have a big group today. I'm just going to give it another minute until we get everybody in from the waiting room. Hi, Cleve. How's the weather in Kansas City today? Alrighty, I'm going to get started with some just housekeeping and opening remarks while we finish letting everybody in from the waiting room. My name is Robin Lerner. I am the Director of Community Engagement and Events here at Charles E. Smith Life Communities. Thank you so much for joining us today for our first program of 2023, Understanding Medicare Fraud and Abuse. For those of you who may not be familiar with our organization, Charles E. Smith Life Communities delivers quality care and meaningful experiences personally tailored to those we serve, no matter where they are in life's journey. Our full suite of care and services available on campus include independent living, assisted living, memory care, short-term post-acute rehabilitation care, long-term care, and primary care services at Hirsch Health Center. If you'd like to learn more about our services, you can visit our website. We'll put this in the chat at smithlifecommunities.org. A few other things, I would like to just thank our sponsors, Optum and Minkoff and Company. We really appreciate their support in helping to support these programs. For social workers, this does qualify for one continuing education credit. A few important things to note. Please make sure that you have logged in with the same name that you used for your registration, as we need to confirm that with our Zoom report of attendees. It is one continuing education credit, and you must be present for the duration of the program. Following this seminar, we will be sending out a post-event email. It will have a survey which you need to complete and return to us by January 31st. It'll ask for your name and email, and then we will be sending certificates for continuing education credit. We will also include a PDF version of the slides that Rafael will be sharing with us. And this program will be recorded, and we'll send you a link to the recording as well. I do believe I've covered all my remarks. It is at this point, it's my pleasure to introduce our speaker today, Rafael Espinoza, who is the director of the State Health Insurance Assistant Program, SHIP for short, and he has served in the healthcare industry for 30 years. He specializes in Medicare and Medicaid and works in both the public and private sectors. Last year, Rafael led the SHIP response to 3,000 Montgomery County residents seeking Medicare guidance and insight. He answers resident calls to help them navigate Medicare health coverage for themselves and their loved ones, and provides answers to questions on how to access Medicare assistance programs. One activity that the Medicare Open Enrollment Program is that SHIP is a prescription drug analysis service, and each year it helps their clients save thousands of dollars on prescription drug costs. At this seminar, Rafael will focus on Medicare fraud and abuse and prevention. Rafael, take it away.
Thank you, Robin. Good morning, everybody. It's my pleasure to be here and to talk about Medicare fraud and abuse. What is a healthcare fraud? Let's start from there. A potential healthcare fraud will be a bill for services you did not receive, bill for something different than what you have received, bill for something that was not medically necessary, or billing for the same services or piece of equipment twice. That's very common issue that many people face with their bills. So It's very important for you to review your medical bill and make sure that what you're being charged actually is the right services and not being charged twice. And that's very common situation. So be aware of that. Billing errors, these are mainly human mistakes. I have to add it to that also some system mistakes. Sometimes the system makes, some errors. And accidentally enter the wrong name or information when somebody's putting the information in their system. If the error is human error and not fraud, work with your provider to rectify the error. Usually you need to call them, be persistent with that. Sometimes you call and nobody answers, you leave messages and nobody call you back. So be very persistent. Even if you have the option to go in person to the doctor's office or to the provider where you receive the services, do that because that will help you resolve the issue. Now, the Senior Medicare Patrol message is that you need to protect yourself, protect all your information, your personal information, the same way you protect your credit card, for instance. You protect your Medicare card, your insurance card, or your Medicaid card. Everything related to your healthcare coverage, you need to protect the same way you do with your credit card, even with your Social Security card. If you detect it a fraud, or do you believe that maybe a fraud is being committed, then the next step will be you have to report it. Don't keep it to yourself. Okay, report it. Even if it doesn't affect you directly, report it. It's important for us, especially for Medicare, to be able to track down these frauds. It can help us save a lot of money. To protect yourself from fraud, what you need to do? Educate yourself about Medicare fraud, as you're doing it right now. Protect your Medicare card and Social Security number. It's very important. Use a calendar or personal healthcare journal to record all your doctor's visits and services. That's very important. Remember, especially for seniors, the older we become, our memory, unfortunately, doesn't work the way it used to be. So it's better to write down, every medical services, doctor's visit that you have been attended. Usually Medicare send you, if you have not created a Medicare account, Medicare sends you a paper Medicare summary notice every 3 months. And for some folks, 3 months is a long time. So it's important to keep a journal of all your medical services, okay? Report suspicious activity to the Montgomery County SHIP SMP. If you are not a Montgomery County resident, if you are from another county or even another state, try to find out what is your SHIP office, information, okay? And report back to them. What you do not do not give your Medicare card or number, your Social Security card or number to anyone except your doctor or people you know should have it. And when they say people you know should have it, besides your doctor, is let's say for you need to do a lab work or a scan or x-rays. Those are the people that they refer, other providers besides your doctor, okay? Do not accept medical supplies or services from a door-to-door salesman or over the phone. these door-to-door salesmen, and what they wanted to do is to try to get you information or just try to sell you something that you don't need. Okay, more likely that is the case. Uh, for instance, just to give you an example, it could be the, you know, now that we are during the COVID-19, try to sell you masks or sanitizers, for instance, or try to sell you even an appointment for a, for a vaccination or screen. They are very smart and try to convince you and get, and buy whatever they are selling. So door-to-door salesmen, don't open the door. If you do, say, no, thank you, I'm fine. Over the phone also are very common scams that call you and ask you, that you need to buy this in order to be better off of something that you don't need, and they try to get all your information over the phone. Sometimes these phone calls is just to sell you, and you probably get something in return. But some many others is just to get you information. And once they got it, you know what's going to happen. They're going to start buying it stuff and using you, or represent you in a different services, medical services. So it's very important for you to be aware of this particular aspect of this, what you do not do when somebody's calling you or knocking your door, okay? Do not allow anyone to review your medical records or recommended services, except your doctor or other medical providers. Some people now is the system of medical records are much better because they give you a disk or or a USB with your information on it. But before, I don't know, some doctors' offices or providers use the old system where they give you a bunch of, information and paper. So be aware, if you have facing that kind of situation, you are getting your medical records and paper, make sure that nobody have access to those other than the people that you intended for, okay? It's very important. When you detect Medicare fraud, what you can do? Well, the first thing you do is read your Medicare summary notices or explanation of benefits. You can actually, when we talk about Medicare fraud, it's also imply any other health insurance that maybe somebody is stealing you health insurance information. So in this case, you read your Medicare summary notices. But if you are facing a health insurance fraud, you read your explanation of benefits, okay? The EOB. Usually you get that after any services being provided to you. So what you do, you watch for services or equipment that you did not receive, services or equipment not ordered by your doctor, billing for the same thing twice, or billing errors. That's what you need to do every time you receive your Medicare summary notice or your explanation of benefits. Where to get your Medicare summary notices? For all those Medicare recipients, or any of you are dealing with Medicare recipients, you get your Medicare summary notices mailed quarterly. That is, you have not created a Medicare account. So, and this is going to be every 3 months. And like I said before, for some folks, 3 months is a long time. So keep a journal of all your medical services, okay? But if you create a Medicare account, you can see your Medicare summary notices monthly. You just open your account and look at it for it, and you will see it. That is more effective in terms of time frame. If you have not received or you have not seen your Medicare summary notices in your account, then you need to call 1-800-Medicare and request one, or inquiring what happened, why it's not posted in your account, okay? Reporting Medicare fraud. Who to contact? If you suspect fraud or notice something suspicious in your Medicare services notices, call, in this case, will be the Maryland SMP at the Maryland Department of Aging for 10-767-1100. Or you contact us at Montgomery County SMP SHIP 301-255-4250. Again, if you are in a different county, you can still call the Maryland SMP because it's the state agency. But if you are out of the state, you need to find your SMP agency at your state, okay? And more likely that will be part of the Department of Aging of your state. Also, you can contact your local SHIP office. Step to report errors. First, try to resolve the error yourself. If you think your provider made a billing or service error, call your provider or supplier as soon as possible. Then, if you cannot resolve the error, if the provider will not explain or correct the error, or you suspect fraud, call again the Maryland SMP at the Maryland Department of Aging for 10-767-1100. Montgomery County SMP SHIP us at 301-255-4250. Or if you are out of the state, to your proper agencies, okay? Phone scams. I'm gonna give you an example. A person calls claiming to be from Medicare, stating that you are eligible for free services. The caller states all they need in return is your information, such as your Medicare number. You then give your Medicare number, but never receive those services or a callback. What is not right in this situation? What should you do next? Those are very important questions. Let's see. This is what you need to learn. Let's go back a little bit. Somebody called you for services, okay? Services that your doctor has not prescribed or your doctor has not recommended. So nobody other than your doctor really need to tell you what you need. Not a salesperson. Okay, so that is not right. If a salesperson call you, try to sell you for services, or try to give you services in exchange for your Medicare information, that is not right. What you should do next, in case you receive that call, or in case you actually fall for it, you need to contact us or contact the Maryland SMP through the Department of Aging, okay, to report the situation. So you need to work with your doctor. Your doctor knows your health needs. If you need medical service or equipment, you and your doctor can make that decision. Only give your medical number to your trusted doctor or any other provider that you may contact. Your Medicare enrolled doctor will write an order for services or equipment when it is medically necessary. Again, so if somebody called you, that obviously is not your doctor. How that can possible know what you need? He doesn't know you or she doesn't know you at all. So keep in mind that, okay? So everything that you need in regards to medical services is your doctor who knows better. And in between you and the doctor decided what is the next step to follow. For phone scams, where you should go for information, you can go to the Federal Trade Commission, Consumer Information, and you can report it right there. And as you can see in the screen, once you are in the in the Federal Trade Commission Consumer Information, you can see in red where you need to click in order to report this situation. Privacy, identity, and online security. You click there and you see the information that the Federal Trade Commission give you. For scams, also they're going to tell you right there about these phone scams that you have been encountered. Okay. Remember, you're going to get this slide. So this information is going to be actually, you're going to have it. So you don't have to keep writing all this. Okay. Now the COVID-19 scams and fraud is still active. Okay, it's not because now we are a little bit losing a little bit these restrictions about COVID. That doesn't mean the scammers is going to go away. No, they still active, very active. So for COVID-19 scams and fraud, be wary of unsolicited phone calls that offer COVID-19 testing kits, vaccines, drugs or supplements to cure or prevent. Some people believe that a salesperson or a scammer can convince you that the cure is already there, that you just need to get it. You are one of the few first ones to have the opportunity to get them. You are in front of everybody else. You know, as soon they start telling you that kind of stuff, you start wondering, so what made myself so special that I'm going to be in front of everybody else, you know? So start questioning, okay? They also offer you supplies, masks, creams, and hand sanitizers. It's still being out there. They also tell you that you're going to get a new Medicare card and COVID supplies. A COVID-19 treatment package. And also they're going to tell you that you may get more Medicare insurance coverage, which is not true. Okay, any of this is not true. Maybe some of the supplies, maybe you get it, but more likely you won't get anything. Okay, so this COVID stuff is still up there, so be aware of it. Okay, and as soon they start asking you either for your Medicare, Medicaid, or your insurance card number and information, you know, and they may ask for some money in also for shipping. So when they ask for some money, guess what they're going to ask you for? Your credit card. So you are not only giving you medical information, but also you are giving them your credit card information. So this is very important. Okay, these scammers will get your medical number and get your credit card number, so you know what's going to happen. So it's very important. What you should know, Medicare will not call you. Usually government agencies communicate with you by mail, not by phone calls, not by email. Okay, unless they tell you they're going to mail you something and you are aware that they are going to email you something. Otherwise, they won't use the email system because it's not secure. You know, so they mainly use mail, regular mail, post office. Okay. So a Medicare representative will not call you to offer you a new car or request information to issue a new car. Insurance companies cannot call you unless they already cover you. So let's say, for instance, you have Cigna insurance coverage, and you receive a call from, let's say, Blue Cross Blue Shield, telling you they are going to give you a better coverage, a lower price, and blah blah blah. So and they're going to send you a plan comparison if you provide you insurance information. Please, if somebody call you asking you for that kind of stuff, just hang up, or you ask questions about how this call originate, why you are receiving the call, how they got your information, if you want it. But if you don't want to go through all that, just hang up. Where you should go for information regards to Medicare scams and fraud. You should go to medicare.gov or call 1-800-Medicare. You can go to the Senior Medicare Patrol. You can go to the National Council on Aging. ARP has a very good program about scams and fraud. And Montgomery County SHIP SMP, or your local SHIP SMP office, or to your state Department of Aging website. Social Security scams. This is also still very active. You have to protect your Social Security number at all the times. Protect your Social Security number or benefits. Government employees will not threaten to take away benefits or ask for money, gift cards, or personal information. Scammers use fake colors IDs. Sometimes it shows a Social Security Administration or even a Social Security Inspector General's fraud hotline number. So remember, government agencies usually do not call. Everything, again, is through regular mail, post office, no phone calls. Now, you may have received, or you may receive a call, telling you that your benefits or your Medicare coverage is being hacked, and they need to reach out to you in order to get this information clarified. Otherwise, you may lose, or you may your Social Security benefit may be a stop, or your Medicare coverage may be a stop. So you need to dial number 1, number 2, whatever the number they tell you, to connect with a Social Security representative. So if you hear something like that, disregard it immediately, hang up. Okay, there's no a Social Security representative that will call you to ask you or tell you that your benefits has been cut off, or they are going to be cut off, or your Medicare coverage is going to be terminated. They don't use phone. If something like that is going to happen, they're going to mail you, send you a notice indicating that you need to contact or go immediately to the nearby Social Security office to clarify the situation, but not a phone call. Okay, so hang up immediately you hear this kind, or you receive this kind of call. How you report Social Security scams? You report your Social Security scams to the Social Security Administration Inspector General. And the information is right there, you know. Also, you can visit the identitytheft.gov/SSA for more tips. For scams, what should you do with a scammer? Hang up. That's simple, very simple. Hang up. Sometimes when I make phone calls, when I'm counseling about Medicare, sometimes the caller ID of the person that I call doesn't bring up where I'm calling from. So when they answer and I start identifying myself, they hang up immediately on me. So they follow up this very nicely because they hang up, and the reason because they cannot identify me. So same thing, and when I finally be able to reach out to them, I actually congratulate them for doing that. You know, even they don't give me the opportunity to explain who I am or what I'm calling for. So, but I congratulate them because that's the way to prevent these scams. You know, hang up. But if you decide to talk with the person, then ask the following questions. What is your name? What phone number are you calling from? What company or agency is this? If you can call them back. If they provide you all that information, still verify how. Let's say, for instance, if they tell you, I'm calling you from, let's say, if you have a Blue Cross Blue Shield insurance and they claim they are calling you from a Blue Cross Blue Shield insurance, if they give you a number to call, don't call that number. Go to the Blue Cross Blue Shield insurance company website and find a number there. And call them and verify in fact this person or these people are calling you. And you'd be surprised, they say nobody is calling anybody. But what happens if you made a mistake of calling the number that they are giving you? Somebody's going to pretend being from that particular company or agency telling you, oh, this is such and such, and you fall for it. So never call the number that they give you. Always find out the number yourself. Okay? And then hang up. Don't give them any information. Very important. So that's it. I hope all this kind of information is not, to scare you. It's actually to make you aware. So you are, if you face any situation similar to this one that we described, you know where to reach us. Okay. So Robin, if we have any questions out there.
Yes, we do. First, thank you, Rafael. That was a really, really interesting presentation. I hope that everyone else agrees with that. We have a bunch of questions. So I'm going to start from the first question and we'll work our way through. Kate asked, what about durable medical goods like braces billed? How would a patient know if it was billed incorrectly?
When you say durable, I'm assuming you say durable equipment?
Yeah, durable medical goods like braces.
Yeah, and braces. How you address those kind of pros? That's what the basic question is. It's about Medicare. In Medicare, you need to contact the provider first. In this case, the equipment supplier. And try to see if that is being billed to you. If you have not received those braces and it's been billed, then you have to report it to Medicare immediately. It's very simple. If you are being billed, not you, but keep in mind, when we talk about Medicare, Medicare is the one who has been billed foreign equipment or services that you have never received. So basically, you are not paying yourself directly into this fraud. It's Medicare who is paying for you. And possible if you have a Medicare or Medicare supplement plan, your Medicare supplement plan also is paying for you. So it's two entities that are paying for you, or you are not being affected directly into your pocket. But listen to this. It is an equipment that only is being offered for a time frame, and somebody else already being used that. When you need it, maybe you won't be able to get it. So it's not only the fraud, it's not only being committed to get payments, but also the fraud affects you for the services or equipment that you may no longer be able to get. So keep in mind that.
Great, thank you for all that. Barton said, and I'm just going to read this, he's got like 2 questions here. I hope the speaker will address whether it is necessary to pay provider fees they charge me above what Medicare pays. I also hope the speaker will address how Medicare works with my secondary health insurance, which happens to be Care First in this case. It seems providers try to get Care First to pay their fees that are above the fees Medicare reimburses.
Okay, the first question is if providers can charge you over what Medicare pays. I'm guessing she's talking about the 20%. So providers charge you, Medicare pays 80%, and then you're supposed to pay 20%. Now, once Medicare pays, and this provider is not an assignment provider, means that doesn't have a contract with Medicare, but is willing to see and get Medicare payments for Medicare patients, these providers can actually charge you an additional 15% over the 20%. They have the right to do that. Medicare allows them to do that. If that's what she is referring to, I guess the Medicare supplement or Medigap have to take care of that if you have the right plan, because not all the plans cover that excess services charge. So only depends what you have, and that could be a question for me to address it more individually, in order to ask questions, what you have, what kind of insurance you have, and all that kind of stuff. So right now it's very generic. Now the second part of the question was, if you can.
Oh, hang on. The second part was, let me just go back to that. Okay, let's see. How Medicare worked with my secondary health insurance.
Okay, first, Medicare is your primary insurance. It covers everything that that is supposed to be covered and pay for it. Your secondary insurance maybe becomes as a supplement. After Medicare covers, your insurance covers. Now, I don't know what policy you have, okay, but
Care First, actually, in this case.
I know that's the insurance company, but the policy, each policy is different. So I don't know what kind of policy this person has, but some policies indicate if Medicare doesn't cover, they will not cover neither. So I don't know what is the situation in this particular case, but if you wanted to know more about coordination, it's called coordination of benefits. You need to go to Medicare.gov and find over there the information about coordination of benefits, because this is a very specific question about a specific plan coverage. My answer is very limited here. It's more general.
Of course. Great. There was just in general, a lot of conversation in the chat about scams, and that Medicare doesn't call you, and you should never give out your number. People said that the scammers are becoming much more efficient and kind of scary, that someone got a call and they knew their social security number. and that, it's really wise to be careful. Someone said older adults are particularly at risk, and what are some helpful hints that can be shared that will make it easy for them to remember? I do feel like you covered that, but anything you'd like to add, Rafael?
Well, and it's right. I mean, seniors are is the target population, and for reasons that you probably all of you already know, easy is they are not so computer wise. There are no alert or many a technical or technology upgrades that we already have. So there are easy prayers. So one thing that they need to be careful is to use the computer. When they use the computer, especially email, some people use email and they get email and they get phishing emails,
Yes.
and then they get a link to click. Easy. These are one very common one that many people fall for it, even some much younger people, is when you get an email telling you that you are being rewarded, and then you're going to receive a $500 gift card if you complete the survey or whatever. And you click the link and dumb. Somebody already hacked your system, got all your information there, password and everything that you have, safe in there. So be careful about using the computer. If you don't feel confident, then don't try it.
Right.
Don't try to use technology, because for new generation it's easy for them, but for older generation it's kind of hard to understand how all these works and how fast actually works. It works very fast. So if you are not with the same speed, you may end being a target. So be careful about that.
Right. Couple of other things on here. One person I really like this said to pause for a moment and ask if you can ask to call back at another time. And I thought that was a great idea if you're not sure about what's going on. Someone else posted that if someone asks for payment via wire transfer or Bitcoin, gift cards, that is a scam because those are not traceable. In Baltimore, Jack Schroeder mentioned that Shauna responds to elder abuse and financial exploitation and provided some contact information there. Let's see. Walt mentioned that the Montgomery County Police Department, Keeping Seniors Safe, we actually did a program with the KSS program, is a free service where you can talk to community groups about safe shopping habits, parking lot safety, etc. And that's police.kss at montgomerycounty.gov. Let's see.
I just want to mention something about the Bitcoin. Actually, I know they use the Select application to get you money, and when you try to get your money back, it's impossible to track it down. Once they had been, commit this fraud with the big famous coin, Bitcoin. I mean, it's be careful with that. And now that I think they are going out of business anyway.
Yeah, I think they are in a little bit of trouble.
Yeah.
And on that note, someone posted that stopping scammers is a complex challenge. Prevention is your best bet, as recovery and restitution is often impossible, especially with perpetrators overseas. Let's see. Does Medicare pay 100% of emergency room fees or 80%? Do you know? Can you answer that, Rafael?
What is it?
Does Medicare pay 100% or 80% of emergency room fees?
80%.
80%. Okay.
Yes. It's in outpatient services.
Got it. Someone posted, if you do answer a call from an unknown number, never answer yes to any of their questions. We've just posted the KISS information in the chat, so for anybody that needs that as well. I think I've gotten all the questions. If I haven't answered your question, can you just pop that back in the chat if I've missed something?
Then another thing that I would like to add
Yeah.
is, somebody talk about international, fraud being committed. Be careful when review your credit card, very diligently, because some people who got you credit card information, they will spend only few dollars. Okay. And when they spend only a few dollars, you don't pay attention.
Correct. Right. Good catch. Yeah.
Okay. You usually look for thousands of dollars of expenditures or hundreds into the hundreds. But when they spend $5, $10, it may not affect you much. But can you imagine if they do the same to 1 million people in the United States? Multiply $5, 1 million. It's $5 million.
Wow.
So it's a lot of money. So
Rafael, you mentioned something when we were talking before we started about not just looking at your summary of benefits, but asking for the details when you get your explanation benefits. Can you talk a little bit about that?
yes, when you actually receive a bill and and it's kind of and you don't feel so confident that the services or the charges are a little bit too high, you always can request an itemized bill. So the itemized bill, we tell you exactly what you're paying for. And in many cases, you may be surprised that you are paying, when you get the itemized bill, you are paying for the same item twice. So itemized bills is a very good tool to see when medical bills are being, sent to you. Now, if you just paying for a doctor's visit, obviously, there's no need for an itemized bill. But if you receive different kind of services in a doctor setup office or in the hospital, that's important for you to get your itemized bill.
Great, thank you. Let's see, I don't see any other questions. Couple of comments that caller ID can be easily spoofed. Allison, yeah, scammers will start with a small amount, and when you don't notice that, they draw out a larger amount. Let's see, Denise posted, please keep in mind that Medicare does have a deductible cost for outpatient and inpatient care. Rafael, do you want to comment on that?
And Medicare has an outpatient.
Has a deductible cost for outpatient and inpatient care.
Yes, currently, let me see, where is my, okay, 2023, because we just started 2023 and those numbers change.
Yep.
And for, it's not based on inpatient, outpatient, it's based on what part of Medicare you're using. Okay, if you're using part A, you have a deductible of every time you go to a hospital, it's a 60 days period is about $1,600. Okay, that's the deductible for part A. For part B, it's much, much cheaper. It's only $230, I believe. Yeah, 230. Actually, it's 226, $4 less. Okay, 226. And that deductible is per year. Remember, part A deductible is 60 days period. And part B, $226 is for 1 year. So those are the two deductibles.
Got it. Thank you. I hope that answers that question. I think we've answered everything in the chat. Rafael, any final comments or suggestions or anything you'd like to add?
No, keep your eyes and your ears very, very open. And keep your mouth shut. Don't say anything, So that way you don't give up any information. Just hang
Thank
up. It's a phone call, hang up. It's an email, delete it, Take all the precautions that you need to take in order to be safe, okay?
Great.
Even if I call you, like I mentioned it before, just hang up on me. You cannot see my number on it or where I'm calling from.
Great
Okay.
advice. Yeah. Thank you so much. This has been so informative. I want to thank you. I want to thank all of you for joining us today. We had a great group, and I think it was some really good conversation and questions. So as I mentioned, just reminders, we did record this. You will get a copy of the recording. It'll be on our website. We will send a copy of the slides. And most importantly, for those of you needing continuing education credit, those of you that were here for the entire program, please fill out that survey in the post-event email. I will try to get that out this afternoon and get that back to us by January 31st. And then we will get the certificates for CEU credit out to you via email after that. Please check our website, smithlifecommunities.org, under the events section for other upcoming events. We'll be doing some other really interesting programs throughout the year, and we do hope to see you on Zoom and hopefully in person again soon too. So I will give you back a little bit of time in your afternoon, and thank you all for coming. Have a great day. Bye.